to your attention so that they can answer the questions which you may have related to diabetes. And today we are going to answer or talk about a topic which is very relevant in terms of prevention of diabetes, and that is, do you have family history of diabetes? This is very important when we are talking about a patient who may have a family history of diabetes, and what kind of precaution needs to be taken for that particular person so that the person doesn't comes out to be the diabetic. So to talk to about it, we have Dr. Samuel Sathwik, who is consultant diabetologist and physician at Dr. Mohan's Specialty Centers, Chennai. Welcome you, Dr. Samuel.
Hello. Yeah. Good evening. Welcome. Yeah. Thank you.
Dr. Samuel, when we are talking about some kind of family history, it is often considered that we have so many members in the family whom to consider that these can lead us in a like future complications. So, who in the family should be considered for family history?
Um, Especially when you're looking at family history and diabetes, most of the times we start with our parents, the mother and father. But it's very important to also look at three generations of family history. So, and all your relatives, both on the mother side and the father side. In fact, when we try to, in all of the young patients, when after they get diabetes, the routine practice is to draw a pedigree chart. And this pedigree chart has three generations of people mapped out. And we try to ask about the diabetes history and the time they passed away. Do they have any other comorbidities? And we map it to all the three generations. Most people are very happy that some of my patients say that my father doesn't have diabetes, my mother doesn't have diabetes, and they assume that they don't have family history, but it's wrong. Uh, if you look at how this thing, the three generational history works, there are specific types of diabetes where you can find out if you have a positive family history in three generations, and if you have got diabetes at an young age, you might be having something called as monogenic diabetes. So to simply answer your question, always look at the three generation family history at both the mother and father side.
That's very important. Otherwise, what we consider is that only our parents do not have any kind of history. So we just take that we do not have any kind of family history. Thank you for clarifying that, Dr. Samuel.
Yeah.
Second question comes when we are talking about diabetes. Diabetes is, of course, there are different types, but predominantly type 1 diabetes and type 2 diabetes. So, does this family history matter for both type 1 diabetes as well as type 2 diabetes?
Very important question. See, every most of them know that for type 2 diabetes have a very strong link with family history. So most of the type 2 diabetes um, has a strong genetic component, but what also plays a greater role is the environmental factors. Even if two people have the same set of genes, if one's environmental factors are worse or predisposing or enhancing the existing bad gene, like for example, bad lifestyle, bad habits, sedentary lifestyle. The person who has a bad lifestyle can get diabetes, and the other might get at a later stage or even can prevent it. But there is absolutely no doubt that type 2 diabetes has a strong genetic link. But what's surprising of late is to find out that even type 1 diabetes has some association with the family history. And 10, 15 years back, when they tried to look at the studies, if to put it, no, let's not go into the numbers because they can be sometimes confusing, but just if a type 1 diabetic mother has roughly around 1 in 20% chance of the child getting type 1 diabetes. And if it is for the father is type 1 diabetic, and again, it has a more risk of developing type 1 diabetes. So it's not as strong as type 2 diabetes because whenever we're trying to diagnose diabetes, most of the times in type people who have been diagnosed with type 1, they have negative family history, which means the parents might not have family histories. but there is data to show that yes, they are at high developing, but to a lesser proportion. And if imagine both the parents have type 1 diabetes, then the risk again doubles. Now, there are studies to show siblings, if you have a sibling with type 1 diabetes, and especially if the other sibling has got it less than 7 years of age, and then you also have a high chance of having type 1 diabetes. So, the same thing was seen again with monozygotic twins. So, for again, the risk again was high. Now, when you look at type 1 diabetes, it's very interesting. There are certain genes called, to put it in layman's term, something called HLA genes, which just make proteins to keep the immune system healthy. Now, all of us know type 1 diabetes is an autoimmune disease. And then people ask, why did I get type 1 diabetes? What wrong? What was the mistake I've done? Probably one of the reasons is probably they have a HLA predisposition, which means if these HLA genes um, have there are certain set of HLA genes like HLA DR3, 4, and also the parents have a family history, positive family history. These people might develop type 1 diabetes. So to put again in a very in a nutshell, yes, both type 1 and type 2 do have some genetic component, and the family history is very important, but it is more for the type 2 diabetes and lesser for the type 1 diabetes. With that said, if your parent or your sibling or either mother, father, or anyone in your family has type 1 diabetes, it's always important to understand that you might also be at the risk of type 1 diabetes. In fact, what we're doing nowadays for siblings who are normal, people come and get diagnosed with type 1 diabetes for the siblings who are normal. We try to do autoimmune panel to look for antibodies like GAD antibodies, and there are certain kind of antibodies to see. And surprisingly, some of our patients turn out to be positive, and then some data shows that they might eventually turn out to become type 1 diabetic. So there is definitely a genetic component also, but it's not as great as type 2. Yes.
And that's very important to understand that not only type 2 diabetes, but these days also type 1 diabetes is related to the family history. And now, as
Correct.
we know, whom to relate to for family history and like both type 1 and type 2 diabetic patients. But these people who are having family history of diabetes, how frequently they should do the screening so that they can recognize it at an early stage and can start a treatment.
So that's a very we don't have clear guidelines, especially for Indian population. Of course, whatever guidelines are there are for the Western, which might not actually apply every time here. But what how I look at is with the increasing incidence of diabetes at even at a childhood stage, like we have a lot of childhood obesity and childhood onset diabetes. I think you should have a very low threshold to screen for diabetes. Uh, what I would look at is if you have family history of diabetes and you have certain risk factors, like when I'm saying risk factors, I'm talking about your waist circumference. Generally, in females, we are looking at values less than 80 centimeters, and males more than less than 90 centimeters. So, certain risk factors like increased waist circumference and obesity, and if we have abnormal lipid profiles, sometimes people go through routine checkups. So, and less physical activity and strong family history, I think you have to start as early as possible. So there is no right or wrong, because we have seen patients even with 15 years age, they are kids, teens who have got diabetes. Now, we have a very simple risk score. Actually, this was done, created by Dr. Mohan. It's called the IDRS risk score. It generally uses four different tools like family history, your age, and the base circumference, your level of physical activity. And based on this, we get a score. And there are multiple scoring tools available. And if you're falling high on this score, I think that's the time for these people have to be screened. Now, I only talked about whom to be screened. So if you have, for example, girls who have PCOS, they are at high risk of developing. So they don't need to wait for a certain age to get screened for diabetes. Now, how frequently do it? Do it once, and if you feel everything is normal, at least repeat it every 3 years. That's what the ADA says. In asymptomatic people, though the ADA says without risk factors, they're asked to screen for 45, above 45 years of age. But in an Indian context, we can go as early as possible, and if it is normal, and then repeat every 3 years. If there is any suspicion of problems like low HDL, high triglyceride, any waist circumference being high, PCOS, or any of these risk factors there, I think you can go very frequently. You can do yearly one screening, and there's no harm in doing that. You can do at least simple HbA1c, a fasting blood glucose, really will help a lot because the data shows that most of these people are diagnosed at a very late stage in type 2 diabetes. That's why even the guidelines advise to screen for complications at the onset of diabetes. So, uh, screen very early, and if it is normal, do it frequently as like yearly once. And if it is not abnormal, do it yearly once. If it's normal, at least do it, repeat it every 3 years.
Thank you, sir. That's very important that we should start it early so that we can prevent it in future. Sir, I wanted to understand, you mentioned that there could be other risk factors, including the age of the patient or the waist circumference. So, in that matter, would increased weight or hypertension can aggravate this family history and may predispose the person for early onset of diabetes?
Absolutely, yes. Because see, all of this hypertension, abnormal blood sugars, even if you go deep, fatty livers, though we look at all this, we have to understand all of them have a common soil, that is insulin resistance. And what's very important to understand is when people always think that diabetes is passed on by the family, but the insulin resistance also is genetic. So, which means some people have a quick tendency to put on a lot of body fat compared to others. So, whenever you have putting on a lot of visceral fat, and with the kind of lifestyles we are living right now, I think that's kind of a disaster for to develop all this. So, when you're looking at hypertension, yes, hypertension is a consequence of something. High fasting blood glucose is a consequence of something. High triglyceride is a consequence of something. All of this is coming rooted deep in the insulin resistance. So yes, and that's why when we talk about metabolic syndrome, this is a whole spectrum of problems where high waist circumference, high fasting, elevated blood pressure, all of these people are at high risk of developing cardiovascular problems. Sometimes people might come with a cardiac event or with a, and then they found out that the sugar also is slightly elevated. And that's why whenever we're talking about diabetes, we should follow a multifactorial approach, not just addressing the sugar alone, but we're also looking at the dyslipidemia, hypertension, and overall visceral fat reduction. Yes.
Sir, you mentioned some of the people may have a tendency to gain more weight or some more visceral fat. So, for such patients, what kind of diet needs to be followed?
Um, there are plenty of formulas and variety of diets available in the market. I try to keep it very simple. Um, Always there are whenever you talk about diet, there are macros, which are the macronutrients, and the micronutrients. So, if you look at the data studies, for example, one of the studies here we have done, Chennai Pure study, Chennai Urban study, most of the people are getting all of the calories from the carbohydrates. So I don't want to demonize carbohydrates, but what I would like to say, as Indians, we are hugely refined carbohydrate eating populations. So when I'm talking about macros, especially carbohydrates, proteins, and fats. Now, the simple formula is first try to cut off all refined carbohydrates and processed carbohydrates. See, a lot of problems are because of the refined carbs. So, carbohydrates are not actually sometimes a problem. The lot of refining and processing that has been done, and this is something which needs to be addressed. And reduce the portion, the contribution. Some people take almost like 70 to 80% of their energy from carbohydrates. I think especially if you're dealing with pre-diabetes or family history of diabetes. It is extremely important for you to cut down your portions of carbohydrates. Now, will that solve the issue? No, because most of the time when you cut down carbohydrates, you're still hungry and you are starving, and people tend to do that for a period of time, and then again they're back to square one. So try to take healthy, complex carbohydrates along with portion control of carbohydrates. Simply put, try to take carbohydrates which are not that easily digestible and which are exactly available from the natural source. Now, this has to be paired with increasing quality protein intake. And this is something, again, just like how we eat a lot of carbohydrates as a population, we also take very, very less protein. So, the recommendation for protein, especially by even the guiding bodies, I'm not talking about a fitness enthusiast, people who go to the gym or fitness enthusiasts do take a lot of protein. But even the general guiding recommendation is to take 1 gram per kg body weight, which means roughly around a 60 kg person or a 70 kg person should be consuming at least 60 to 70 grams of protein. But if you really work into our diets and calculate how much protein we are getting, I think hardly people are taking 30 to 40 grams. I don't think people are getting even 40 grams. So prioritizing protein, and there is again a debate between which kind of protein should you have, plant protein or an animal protein. I'm not going there because there's a never-ending debate. But understand that whichever you choose, but prioritizing protein is very, very important. Make sure you're doing portion control and then increasing your protein intake. Along with that, very important thing is to add in healthy fat. So not all fat is bad. Okay. So whenever talking about healthy fats, if you're a non-vegetarian, you can get fatty fish, meat also helps. Seeds, lots of seeds and nuts, and you get healthy fats from these sources. And cannot emphasize the importance of consuming fiber, especially through lots of vegetables and selected fruits. So selected fruits, lots of vegetables, you get a lot of fiber, prioritizing protein, reducing portion control for carbohydrate, including complex carbohydrate, and taking healthy fats. I think if we make that, in fact, we did when we a study showed that if just readjusting the protein and the carbohydrate ratio in our meals could actually reverse diabetes. So for some people, it can prevent them from getting even diabetes. So this, as overall, this is the macronutrient changes people need to make, and they don't need to wait until they get diabetes because they already have at a high risk of developing diabetes. And regarding certain micronutrients and certain vitamins, vitamin D is extremely important. Everyone are low on vitamin D. It has been a strong link with the immune regulation and also onset of diabetes. Vitamin D is important. Chromium is supposed to be important. Zinc is related with immunity. So there are multiple micronutrients. If you're not having a balanced diet, I think these are not very, I would say, they're not complicated. This is simple things, simple dietary changes. If a person, even before they get diabetes or a pre-diabetes, they start incorporating into their lifestyle, I think there will be a huge change. They can even at least delay the onset of diabetes. I know that was a long answer. I
No,
think
but
that
that was
helped. Yeah,
required, sir. When we are talking about India specific like food, carbohydrate plays a major role here in our diet, and protein we many a time miss out. So that was required to clarify. But diet is one part of lifestyle modification, and when we are talking about apart from diet, exercise comes along with it. What is your thought on
absolutely. Yeah.
exercise for such patients or such people?
So the general recommendations are, I think they're very easy. So they're asking just for 150 minutes of moderate to high intensity exercise. So sometimes I really see a 30-year-old comes and says, "Doctor, I walk for 2 days in a week," and that's not even a moderate high intensity. And you can see this guy walking just along the park, talking on the phone or something. I'm not saying even that is better than not doing something, but especially according to age, we are looking at a moderate high intensity exercise at least 150 minutes per week. I think that's pretty much doable. So, and at least two sessions of in a day of resistance training. So for the exercise, exercise is extremely important because uh, many people think that use exercise only as a tool to control the sugars or people to lose weight. But in fact, you have to understand, forgetting about those small benefits you see, you have to look at exercise in a very holistic way. It does have a lot of benefits, not only in preventing diabetes, it helps to improve your blood circulation, muscles, your mood, and there are so many other benefits of exercise. Generally, we recommend three principle called FAR principle. Means flexibility. So it could be yoga, it could be flexible stretching exercises, and then aerobics. Aerobic exercises are nothing but which can raise your heart rate, especially extremely good for your cardiorespiratory fitness, which means you are raising your heart rate. And aerobic exercise, which could include swimming, jogging, running. All of these are part of cardiovascular, aerobic exercise. And the third thing, which again is very much neglected in India, which people think that it's only for people who are working out in gyms or for some muscular men, is very important is the resistance training. At least you have to include a bit of resistance training, especially if you're young. And because resistance training has been shown to improve your muscle quality and improve insulin resistance. So now, sorry, improve insulin sensitivity. It improves the insulin sensitivity. So one of the major factors, I would say, now there are genes and some things you cannot do much about the genes. But what can you do? At least what is in your hand is to address to prevent the genes from manifesting the disease. So these are few ways where resistance training again will help to improve the insulin sensitivity. So resistance training, you're working on the muscle, and cardio in the aerobic you're trying to working on the fat. So combination of this along with flexibility, I think is a fantastic mix that people not only with many people think that it's for diabetes, but uh, I feel that every person who has a family history already in their family should consider that you are already at high risk of developing diabetes. So FAR principle is what we recommend: flexibility, aerobic, and the resistance training. In a population like India, probably resistance training might not be very practical for someone, everyone, but for young people, at least 2 sessions a week is really going to make a difference.
That's very important. I guess far that mnemonic will be very easy to remember what kind of exercise needs to be done. So as we know that whatever precautions are taken, there are few people who may develop diabetes. So for such people, when they need to see a doctor?
See, the uh, first step at least is screening. Yes. Now screening, if your parents have diabetes or you have risk factors, I think get screened as early as possible, at least once. Even if the patient is 20 years, I would say go baseline, do the screen, do a simple test. Now if you find any of these changes like elevated fasting plasma glucose, elevated fasting. Some people will come only with their fastings elevated. The HbA1c might be low, or any HbA1c even in the pre-diabetic range. Of course, when the HbA1c is high, people will come and meet the doctor. But many times, many people will have in the pre-diabetic range, like somewhere between 5.5 to 6.5 is the pre-diabetic range for HbA1c. And many people do have 5.9, and then they don't even understand that there is the problem has already started. It's just only a matter of time. So all of the spectrum, people who are falling in the pre-diabetes should really have at least a single consultation. They might not need continuous frequent monitorings, but at least they should need sit with their doctor and try to understand this, because awareness is extremely important, because that's the stage where you can reverse the whole condition that's happening. So any kind of pre-diabetes like IFG, IGT is the stage where only on a test we do. For example, to break it down in a simple language, if someone comes to the doctor and asks, "Doctor, I want to know where I stand regarding related to my sugar." So we advise something called a GTT test, which is a glucose tolerance test, where we give them glucose. And many people ask us, "Why are you giving glucose? I don't want to have glucose," because what we're trying to do is we're trying to challenge their body to see what the capacity of the body, whether it can control the glucose sugar, rise in sugar. So using the GTT test, we have three samples: the fasting, the 1 hour value, and the 2 hour value. Based on these three values, we can do a fantastic assessment of where this person is standing. So we can know as early, like there is something called pre-diabetes where only the 1 hour value might be elevated. So these kind of patients, any kind of changes on this, first they need to see the doctor. And of course, if they have uh, developed diabetes already, it is very important to also screen for all the complications. So even though many people ask, just now I got diabetes, and why should I do all the complications? The baseline screen is because sometimes you really don't know when you have already when the problem has started. There are people who have we found even pre-diabetic state with cardiovascular problems. When people present itself, they can have retinopathy and neuropathy. So pre-diabetic spectrum, once you have become diabetic, meet the doctor and then do the basic screening. And from there, if there are nothing abnormality, you can do obviously the whole screening probably after a year or 2 years or something. But I would encourage them to do HbA1c every 3 months once they become diabetic, and monitor their sugars. So this is should be like a lifelong protocol, because that's there is no other way to get keep the diabetes under check. So did it answer your
Yeah,
question?
definitely, sir. You answered the question and very rightly mentioned that even if the patient has developed diabetes, it's need for the patient to get diagnosed or screened for other complications. That's very important.
Exactly.
So you have spoken about what exactly is family history, who needs to screen, and how frequently they need to screen, what kind of diet or lifestyle modification they need to do. Any concluding message, sir, you would like to give to our audience?
Yes. Thank you. See, what I would like to tell all the audience here is, if you have family history, understand that it is a warning sign. Consider this as a warning sign. Of course, it was not in your control, because it was. If I have family history of diabetes, it's not in my control. But there are certain things which are in our control. Even after having, especially if you have strong three generational family history, extremely you are at a very high risk. Both your parents are at family history, again you're at high risk. If you have family history, get screened early. First key I would say is screened early. There's no harm with the kind of facilities we have now. I think simple tests, very easy. At people, we have home collections available now. So I think get screened early. Second, keep always watch out for the risk factors. Like, for example, people have just measure with a simple measuring tape. What's your waist circumference? And then if you're falling, if you're a girl and you have a waist circumference of more than 80 centimeters, it's not a point to be depressed about, but I think you can do something about it, because certain things are have got as gifts. I would say the parents have given us gifts to us. Okay, if you leave it like that and you don't fight it, and then the whole thing will suck you in. So get screened early, get diagnosed early, and key is awareness. Read about it. There's a lot of material right now on the social media. Of course, it can get very confusing because there are different kinds of opinions. So get your information from authentic sources, and there is no harm. Once you screen, go to your proper doctor and then get it. Just clarify your doubts. I think, especially if the patient is lying in the pre-diabetic range, the whole key is not medication. So we also say the key is awareness. Get aware about your diabetes, because if you do that, you're not only doing yourself a favor, you're doing your parents favor, and also the next generation. And if you're not get married, you have to understand that, especially for type 2 diabetes, there's a high chance whatever you're eating, there's a high chance that you're transmitting your behavior also. And of course, that's a very big subject. So get screened early, get educated, and I want everyone in the audience to first check. If you do a pedigree chart, if you possible, go to a health professional, get a pedigree, ask your relatives simply how many people have diabetes, what are the medical problems we have, you're at high risk, and then start implementing the change. Action is obviously very important. There is a lot of information, little steps every day, I think really is going to make a change.
Thank you, sir.
Thank you.
Thank you for sharing the pearls of wisdom here. And I'm sure with this talk, at least some of our audience would be able to get help, and can prevent diabetes. Thank you so much.
Thank you, Dr.